patient's chart for limitations in physical activity or contraindication to the procedure. This is to ensure the patient's safety and avoid discomfort. Now I'm going to perform hand hygiene to prevent cross-contamination. Next, I'll be identifying the patient and explaining the procedure. So good day, sir. I am Amber Marcelo, your assigned student nurse for the day. May I know your name, boss? Your birthday? Can I check your ID blood for confirmation, boss? So for today, I'll be washing your hair with shampoo. Is that okay with you? Okay, so now I'll be preparing the equipment needed on the overbed table to maintain clean and organized procedure. Now I'm going to remove the patient's pillow and place two protective pads under the patient's head and shoulder. Okay, so now I'll be putting the shampoo board under the patient's head. Then I'm gonna put a towel on the edge of the shampoo board para maging komportable yung patient. Sir, pamove po ng konti mo. Pwede yung pamove po. Okay, so now I'll be placing a drain container on the floor to catch off the runoff water and not get wet. Now I'm gonna ask the patient to, if he is able to, put this washcloth on his forehead to avoid his forehead and his eyes from getting wet. Paano po? Okay. So now I'll be putting on my gloves. Before that, I'll be preparing the pitcher with warm water, usually for the 3 to 6 sessions. Okay, now I'm gonna rinse off the patient's head with the warm water slowly, and making sure that the hair are all saturated. Now I'm gonna start. Now I'll be applying a small amount of shampoo to remove the dirt and the oil on the patient's head. I'm gonna rub the shampoo deep on the patient's scalp and avoid cuts, lesions, and sore spots. to remove the hair conditioner on the patient's head. So, okay, now that we are done with the shampooing, I will now remove the shampoo board. Also gonna remove the tooth towel. I'm gonna pat the patient's head dry. So you can So we have to pat the patient's head dry and avoid cuts, lesions, and sore spots. Now I'll be removing the two protective pads and changing it with a new one. Now I'm gonna blow dry the patient's hair in a cool setting if the patient requested, and if not, we could just put on a dry towel on the patient's head. So, sir, do you want to get your hair blown dry? Okay, so I'm gonna wrap a towel on the patient. Okay, so after that, I'll be removing now the patient's under cover a protective pad, then replacing it with a new pillow. Now the patient can return to a comfortable position. I'm gonna change the patient's gown as well as the pillow. Then I'm gonna ask the patient to return to a comfortable position. So you now sit closer, you can now return to a comfortable position. Then I'm gonna lower the bed, raise the side rails for the patient's safety, and then I'm gonna remove my gloves